All right, now for the diagnosis. So I had a complaint of lumbosacral and cervical pain. So I need to have a diagnosis for each section that I am treating slash that I have a complaint for. So just general neck complaint, I don't have any reason for it. I don't have any kind of imaging or anything like that. So we're just going to go with a very generic cervicalgia. And then if, let's say in my, lower back, never had this before either. I did already state that it wasn't traveling down my leg at all, so we're not going to do like a radiculopathy or anything like that. Haven't had it before, so just kind of generic low back pain. Let's say injured myself, you could do like a sprain strain, but make sure you include both of those for each section. So for neck, you do sprain and strain for the neck section, and then, same for thoracic, sprain and strain. Make sure you have that. And then we'll post that diagnoses. And then we'll go over to free text here. The computer is not wanting to. There we go. Okay, and so we're going to add in that date stamp. Let's say, yeah, I did better after my treatment. I tolerated it well without incident. That is important. We need to have that. Dr. Mario said that was extremely important for risk management. Let's say, yeah, immediate relief while in the office. Let's say my relief is lasting longer too. Benefits are lasting longer. Yeah, outline goals are being met. Great. Maybe I have some complicating factors. If I was older, maybe my age, pain for more than 8 days. I can put that in there. Phase of healing, like if I had like an injury or something, or maybe we're in the remodeling stage of it. You can stick that in there. If I'm not being compliant, we can click on here. Maybe I'm not following recommendations, missing appointments, rationing care. If we have those wellness patients that are just coming in once a month, we're billing insurance, and we have like an active treatment plan, I know that some of the doctors have been kind of putting that in there, like they're not coming in as often as really they should. Okay, and then normal visual appearance. I don't look any different than I did last time. I don't have any abnormal gaits or anything like that. I like this one here. It's called Upon Palpation. It just kind of confirms everything that we did. It shows that medical necessity. I have a habit of clicking things twice by accident. There we go. And then the adjusting technique used. So however I like to be adjusted, SUD, drops or impulse. All right, so I did include on mine the AI tool down here. If you guys want to add that, I can do a video on how to pin these, but I have this AI tool just because I ask patients whether it's okay if I use AI to kind of help record and transcribe our visits. I have not had one person say no yet. Now, if I have a patient that is underage, I will have the parents sign off on a consent form. I will have them sign that before I do anything, and that's usually just if they're underage. For all of our new patients, we have on the kiosk, they are already going to acknowledge this consent form for AI already. So if they are newer kiosk patients, they are already acknowledging this. So then I'll just document that we have that acknowledgement in their file, and we can use AI to kind of help with the note.